Hello, nurses all over the world. I want to welcome you back to my channel. My name is Nurse Felicia. The last time I talked about gout, and it was so amazing. A lot of feedbacks from you all. I want to encourage you, if you have not watched that video, kindly go and engage it. You will indeed learn from it. So as requested, today we'll be talking about rheumatoid arthritis. I want us to go straight into the topic because we'll be dealing with a lot of things today. Rheumatoid arthritis is an autoimmune disease whereby the body's immune system mistakenly attacks its own tissue. They see it as a foreign body, so they attack it, particularly the lining of the joints. That's where they attack in this particular disease, which leads to inflammation, pain, swelling, and stiffness of the joints. What is the cause of this rheumatoid arthritis? The cause is unknown, but it is believed to be a combination of genetic and environmental factor. The next thing is the risk factors of rheumatoid arthritis. Number one is that women are more likely to develop rheumatoid arthritis compared to men. The second one is people with family history of rheumatoid arthritis are at greater risk of having this rheumatoid arthritis. And the third one is smoking can also increase this particular disease condition. And also alcohol consumption can also add to the development of rheumatoid arthritis. Let's move straight to signs and symptoms of rheumatoid arthritis. Another name for signs and symptoms is clinical manifestation of rheumatoid arthritis, which are joint pain, swelling, stiffness, especially in the morning. So patients can come to you and say, all these things I experience in the morning, then you are trying to connect the dots. The next one is fatigue. Another one is weight loss, fever, loss of appetite, tenderness in the joints, and warm red swollen joints. So it's also evident when you see all those things. The next thing is the stages of rheumatoid arthritis. There are 4 stages of rheumatoid arthritis. Stage 1 is the early stage of rheumatoid arthritis, which has to do with joint inflammation, minimal damage, and the symptoms. So I will just go into each stages. I want to explain so that you can understand. So stage 1 is the early stage of rheumatoid arthritis, which has to do with the joint inflammation, whereby the lining of the joints becomes inflamed. But there's minimal damage. There's little to no visible damage to bones on X-ray. So if the patient go for X-ray, it might not be visible, damage may not be seen when it comes to this early stage. And what are the symptoms of this stage 1? Is pain, stiffness, and swelling in the joints. So the patient can still go about his or her daily activities with this particular stage. The next one is stage 2, the moderate stage of rheumatoid arthritis. It has to do with cartilage damage, whereby the inflammation of the joints begins to damage the cartilage. You know, the work of the cartilage is to cushion the bone. So if the cartilage is now damaged, then there's issue with the bone. The bone also is at risk. Another one under this stage is joint stiffness. The stiffness begins to increase. I want to cast your mind back to stage 1. In stage 1, there's joint stiffness, but there's increase in joint stiffness in stage 2. So, and the range of motion may be limited. When the joint is affected, then mobility can also be impacted here. And on X-ray, there might be early sign of bone erosion. It might be slight, not really visible. Then let's go to stage 3. The stage 3 is severe stage of rheumatoid arthritis, whereby there's bone damage. There's significant bone erosion and joint deformity in this stage. So another one is severe pain. There's severe pain and stiffness in this particular stage becomes severe, impacting daily activities. So patient is limited when it comes to daily activities. The last one on this stage 3 is disability. Joint damage may lead to disability. Yes, when the patient is not able to perform his daily activities, then there's disability. The last stage, which is also known as stage 4, is called the end stage of rheumatoid arthritis. In this particular stage, there is joint destruction, whereby there is severe joint damage with bone erosion and fusion. Another one is there is significant disability in this particular stage, whereby there is severe limitation in movement and in function. Patient is not able to go about his or her daily activities. The last one under this stage is joint replacement. Yes, there is joint replacement surgery may be necessary here. In this end stage, there's nothing the patient can do other than to go for joint replacement. Okay, and I want you to note something, that not everyone having this rheumatoid arthritis go through all the stages. In the sense that if there's early diagnosis of this rheumatoid arthritis, then the patient can be quickly treated and not pass through all the stages. Let's talk about the diagnosis of rheumatoid arthritis. How do we diagnose rheumatoid arthritis? The first one is physical examination. When we are talking about the signs and symptoms, I talked about tenderness, stiffness, severe pain. You see it while doing the physical examination. Another one is blood tests can be carried out, and there are 3 things that can be done for the patient. The first one is anti-CCP antibodies, which is also known as anticyclic citrullinated peptide antibodies. So this can be done for the patient. Another one is ESR, which is also known as electrolyte sedimentation rate. This can also be done for the patient. And the last one is CRP, which is known as C-reactive protein. Why are we carrying out this test? Is just to mark the level of inflammation in the body. That's what CRP is used for. The last one is imaging studies, whereby the patient can go for X-ray, can go for ultrasound, and the patient can also go for MRI. So let's quickly talk about the management or the treatment of rheumatoid arthritis. I want you to know that there's no cure for rheumatoid arthritis, but treatment can help manage the symptoms and also slow this disease progression. Let's quickly talk about the management or the treatment of rheumatoid arthritis. I want you to know something, that there's no cure for rheumatoid arthritis, but with this treatment that I'm going to talk about, the disease condition can be managed. The treatments can help manage the symptoms and slow the disease progression. So the first one I'll be talking about is medication. The disease-modifying anti-rheumatic drugs can be used, and they are a group of medication primarily used to treat rheumatoid arthritis. They work by reducing the progression of the disease, reducing inflammation, and improving joint damage. They can also improve it. There are 2 types of these disease-modifying anti-rheumatic drugs. The first one is traditional DMARDs and biological DMARDs. I'm not going to go into that you can study in your pharmacology. The next one is corticosteroids. Corticosteroids can be administered. Another one is non-pharmacological intervention under this treatment are exercise, physical therapy, occupational therapy. The patient can be encouraged to go for all this. And also lifestyle modification can be advised in the case of diet, weight management, smoking cessation. So patients can be encouraged to stop smoking, which will also help them with this disease condition. Another one is patient education and self-management. As a nursing student or a practicing nurse, I know that the place of patient education cannot be overemphasized. It's what we do daily. So you have to explain to the patients the disease condition, the progress, and everything that has to do with this particular disease condition. So it will help in the care of the patient, and it will help in the management and the recovery of the patient. Another one is surgical intervention. For example, when we're talking about the stages of this rheumatoid arthritis, in the end stage of rheumatoid arthritis or the stage 4, we talked about joint replacement. So what is the prognosis of this disease condition? It is incurable, that is, it has to do with a lifestyle management. So let's talk about the complication of rheumatoid arthritis. If rheumatoid arthritis is left untreated, then it can lead to joint damage and deformity. It can lead to disability, as we have talked about it in the stages. It can lead to cardiovascular disease, osteoporosis, infection, and eye issues or eye involvement when there is complication. So, to our nursing diagnosis. So think about nursing diagnosis that we can give this patient. And I want you to put it in the comment section. But I'm going to be giving you two today. The first one is acute pain, and the second one is self-care deficit. I want you to add yours to it. So the next one is our responsibility in the care of patients with rheumatoid arthritis. Yes, I am so excited because this particular part is so important to us. As a nursing student and as a practicing nurse, you have to know this. The first one is assessment and monitoring. So you have to do your comprehensive assessment. You gather your information about the patient medical history, symptoms, functional ability, their pain levels. Then you do the joint assessment. How do you do this? You evaluate the joint inflammation. Is there tenderness? Is there swelling? How is the patient with range of motion? So you want to check all that. Monitoring vital signs. So you carry out vital signs to detect any early signs of complication. So you also ensure that the patient also carry out laboratory tests. Then when it comes to pain assessments, you use appropriate pain scale to evaluate the pain intensity and quality. Then when it comes to the pain management, you have assessed the pain. So how do we manage the pain? You administer the prescribed analgesics and anti-inflammatory medication. Then the non-pharmacological intervention when it comes to pain. Diversional therapy, you can do that for the patient. You can engage the patient in conversation. You can turn on the TV on the wall. You can give the patient newspaper to read. You can give the patient storybooks or the things that interest the patient. Is it music? You can turn it on for the patient. And you can teach the patient relaxation techniques. You can apply it or cold compress for the patient. Another one is you do patient management education. You instruct the patient on effective pain management strategies. I've already said that. Then another one is patient education. So you explain the disease process to the patient, its causes and progression. You explain it to the patient. You talk about the medication management. You provide detailed information about the prescribed medication, including the side effects and monitoring requirements. So you tell the patient their drug regimen. You ensure that the patient is taking their medication. And another one is joint protection. So you teach the patient techniques to protect their joints and prevent further damage. Another one is energy conservation. You provide strategies to manage fatigue and conserve their energy. So if it's for the patient to be assisted, if you want to encourage the family members to assist the patient in some things so that further damage can be prevented. Another one is exercise and physical therapy. How do we achieve this? You emphasize the importance of regular exercise and referring to physical therapy as needed. So in this case, you can refer the patient to a physiotherapist. Another one is self-management. You empower patients to take an active role in their care. Let's talk about the functional ability and self-care. How do we achieve this? You assess activities of daily living by evaluating the patient's ability to perform self-care tasks. Another one is assistive device education, whereby you teach the use of assistive devices to promote independence. So you can teach the patient on what to use, or you can refer them to an occupational therapist who will then advise them more on the things that they can use. Another one is home safety. You want to identify potential hazards in the home and recommendation modification. So you want to do all those things so that the patient do not further damage their joints. Another one is psychological support. And the first one under this thing, on this particular point, is you listen attentively to your patient and you show empathy. You don't tell them that I know what you are going through. You can't know what they are going through. You can't know the extent of the pain they are going through, but show empathy, like you are there to help them. But I want to assure you that I can actually contribute my own help or support you to relieve you of this pain. Okay. So another one is coping strategies. You teach the patient coping mechanism to deal with this chronic illness. So teach the patient how to cope with the illness. Another one is referral. You can also refer the patients to the support group or mental health professional if needed. Because in the complication, I talked about psychological issue. Patients at times can come down with mental illness when this disease condition is really eating them up. So you can refer them to a mental health professional if needed. Then you can also collaborate with other healthcare team by communicating with the physician, report the changes in the patient condition and treatment response. Another one is the coordinating care. Work with other healthcare providers to ensure comprehensive care. Yeah, you know you can't do it alone as a nurse. You have to work with other healthcare professionals, pharmacists, physiotherapists, occupational therapists, doctors. You have to work lab scientists. So you have to work with other healthcare professionals in making sure that this patient is safe and is doing well. Another one is collaborating with other healthcare professionals by communicating with them, reporting changes and patient condition. You report changes in patient condition and treatment response. Another one is coordinating care. So you work with other healthcare provider to ensure comprehensive care. You ensure that the patient receive a comprehensive care. All right, so we've come to the end of this topic. I want to hear from you. I want your contribution, your question, and tell me that topic that you're finding hard that you want me to treat, and I'll be more than happy to treat it. My name is Nurse Felicia once again, and until the next time, bye.